Today, I'm going to talk something very, very interesting and crucial. This is Geetha Mikkilineni, your menopause coach. What is menopause? Menopause matlab kya hai? If I have to talk about the simple traditional definition of what do you mean by menopause, here we go. When the periods stop and for continuously 12 months, you don't have any sort of bleeding continuously for 12 months, that day you are declaring yourself up by menopause mean once again. Continuously for 12 months, at a row, continuously, consecutive months, no chumps, no bleeding, no spotting. Only then आप बोलते हैं हाँ मैं menopause में हूँ. उससे पहले there are many stages to menopause which we are not aware of, and that's why there's a lot of confusion. This is a very traditional basic definition of menopause. There is another reason why you hit menopause. It is induced menopause, medically induced menopause. What is medically induced menopause? For medical reasons, you have undergone menopause. You've got your uterus removed or ovaries removed, or in India, it is called hysterectomy. For medical reasons, or in other words, it is called surgical menopause. So there are two kinds of menopause. One is spontaneous menopause, where 12 months continuously आपको chance नहीं मिलता. दूसरा है induced, medically induced menopause, or menopause for medical reasons, or surgical menopause. In India, it is called hysterectomy, wherein you undergo the operation to get your uterus removed for medical reasons. What could be the medical reasons? There could be a heavy bleeding where it is going to be dangerous for the lady who's undergoing, or the lining of the uterus will become very thin, or it is bulging, or the fibroid size is very large than the permissible size. Normally, fibroids, which are very small, they get nullified in the process of the menopause journey. But if your doctor recommends you to go ahead, so take a second opinion, take a third opinion, only when you feel that, yes, I need to undergo the operation. Because sometimes if the bleeding is so severe and heavy, the hemoglobin comes down, your iron levels drop down so much that you can be health risk, or uterus cancer can be attracted. Then it is recommended to go for surgical menopause. All right. Otherwise, I would recommend ladies not to jump into the operation just like that, which you will get to know why you should not be doing it. Okay. So two definitions: surgical menopause and spontaneous menopause. But do you know there are so many stages to menopause? Much before the date where no periods for 12 months is there, you will be noticing 8-10 साल पहले, 8 to 10 years before the actual date of the menopause, we step into a stage called perimenopause. What is it called? Perimenopause. What happens in perimenopause? Slight irregularity in your periods. Very slight irregularity in the periods. There are 39 perimenopausal symptoms which we experience. Slight change in the moods. You're forgetting small things. You will see there'll be cramps in the stomach, soreness in the breast. There is a slight drop in the hormone imbalance. That is stage 1 of the perimenopause. So, samjho if you're hitting menopause at the age of 47, 49, 10 years before, 37 to 40, around that, these kind of symptoms you would start noticing. What is stage 2 of perimenopause? The hormone decline sets in. Hot flashes are coming in. What are hot flashes? I will explain you. It is excessive sweating. You'll start noticing, why am I sweating for no reason? Sleep disturbance, insomnia, you start setting in. You'll also start noticing like you're gaining weight around your abdomen area. Coming to the physiological, biological requirements, vaginal dryness, no interest in sex, low sexual drive. Or when you force yourself to intercourse, you will see it is painful and you would want to avoid. Now, the irregularity of your monthly cycles is becoming predominant. Ovulation is not happening at the right time. Small things you're seeing. Moods में फर्क है, sleep में फर्क है, physiological changes में फर्क है, the intimacy with your husband, there is a little change. All of these are setting in. When is this happening? As I told you, 8 to 10 years before the actual date of the menopause. That's why I told you, if you've crossed your 40th birthday, gift yourself, because you need to take action here. What's the third stage of perimenopause? Here you will start seeing many changes. Periods become fewer. What used to be a 28, 30-day cycle, now it gets shortened or it gets longer. The flow becomes heavier in certain cases. The flow becomes lighter in certain cases. You will see the period cycle going haywire. Like, for example, what used to be 3 days, 4 days will become 8 days periods, 9 days periods. And you think, what's wrong? And the periods stop. 20 दिन के बाद again शुरू हो जाते हैं. And gradually you start noticing the period cycle is reduced. 1.5 days, 2 days. Sometimes there'll be only blood clots. They will also start noticing the color of the blood getting blackish, reddish. Now, coming back to the symptoms, they're getting worse. You're not able to recall certain things. Arey yaar, mera chabi kahan hai? Where are my spectacles? Where is my phone? You start seeing you're forgetting things, brain fogging. Most of you will start experiencing frozen shoulder or knee pain, lower back pain, or certain kind of tightness in your body, inflammation in your body. Nowadays I can't eat things I used to eat. You feel indigestion issues, inflammation issues. Most of y'all also start seeing drop in the strength, muscle loss is happening. The biggest is a weight gain, which is very, very like the fat percentage in the body is going higher, and you see the flappy, loosey fat around your abdomen area. These are the 3 stages to perimenopause. When are they starting? 8 to 10 years before they will start, giving you an indication. This is one of the toughest periods of women's life. You're not aware of what is happening and you don't know what to do and how to take it to the next level. Many ladies actually see anxiety levels go up, emotional imbalance, relationship issues. They catch unwarranted health risks during the stage of menopause, like, type 2 diabetes or hypothyroid and kind of things. Coming to the stage 4, the actual menopause, like I told you the definition, periods stop continuously for 12 months, the first anniversary of your last period. And that's why it's called second puberty or second spring. When you hit menses, the periods have started, the ovulation has started. Estrogen is a hormone that starts secreting then in the ovaries. And you come to a journey, a long journey has happened all this while. You've reached a stage where the periods have stopped and ek saal gira ho gaya. First anniversary of your last periods. That is where you hit the stage called menopause. Like, you got periods last year at the same time, maybe in June 2023, and one whole year, not a single day you have periods. And then you hit May 2024 and tell, okay, no periods for a year. I'm in stage 4 and that is called menopause. Now, how do you keep track of it? Start marking in the calendar. The best way is to start writing your journal or writing. What are the moods? How did the moods transform? What is happening right now within me? Start marking, start making the notes of your dates, of periods, your feelings. You will be able to see a huge difference in yourself as you move through these stages. The kind of when you ask me what age I will hit menopause, there is no blood test which can tell you, "Apna agle saal aapko menopause aayega." There's nothing like that. If somebody is telling you, please get a blood test done, we will understand. No, you will not be able to. People are fooling us. Maybe you'll know the levels of estrogen. Maybe you'll know the SHF. You'll know the levels, like how you have no deficiency levels, vitamin D deficiency, get a blood test, and iron deficiency, get a blood test, and that kind of levels you will know. But at what stage of menopause I am, it's just like, it is like puberty. Your mom knew you will hit this summer holidays, but she did not know which year you will start menses or you start menstruating or puberty hits you, right? It's the same year.